Are you studying for exams like SPLE, MOH, DHA, HAAD, or NAPLEX? Let's go through some important MCQs to help you prepare. Let's begin. Number 1. What is the primary mechanism of action of proton pump inhibitors like omeprazole? Option A. Inhibit histamine release. Option B. Block H2 receptors. Option C. Irreversibly inhibit hydrogen potassium ATPase. And number D. Neutralize stomach acid. The correct option is irreversibly inhibit hydrogen potassium ATPase. Number 2. Which drug is most appropriate for managing an acute asthma attack? Option A. Montelukast. Option B. Salbutamol. Option C. Beclomethasone. And option D. Tiotropium. The correct option is salbutamol. Number 3. What is the therapeutic use of warfarin? Option A. Antiplatelet therapy. Option B. Anticoagulant therapy. Option C. Fibrinolytic therapy. And option D. Vasodilator therapy. The correct option is anticoagulant therapy. Number 4. What is the antidote for benzodiazepine overdose? Number A. Naloxone. Number B. Flumazenil. C. Atropine. And D. Protamine sulfate. The correct option is flumazenil. Number 5. Which of the following is a characteristic side effect of angiotensin converting enzyme inhibitors or ACE inhibitors? Option A. Hyperkalemia. Option B. Hypoglycemia. Option C. Bradycardia. And option D. Peripheral edema. The correct option is hyperkalemia. Number 6. Which antibiotic is a first-line treatment for uncomplicated urinary tract infections? Option A. Ciprofloxacin. Option B. Amoxicillin. Option C. Nitrofurantoin. And option D. Vancomycin. The correct option is nitrofurantoin. Number 7. Which class of drugs is commonly used to treat dyslipidemia? Option A. Statins. Option B. Beta blockers. Option C. Calcium channel blockers. And option D. Anticoagulants. The correct option is statins. Number 8. What is the recommended first-line treatment for type 2 diabetes mellitus? Option A. Insulin. Option B. Metformin. Option C. Glipizide. And option D. Pioglitazone. The correct option is metformin. Number 9. What is the mechanism of action of losartan? Option A. AS inhibition. Option B. Beta adrenergic blockade. Option C. Angiotensin 2 receptor blockade. And option D. Calcium channel inhibition. The correct option is angiotensin 2 receptor blockade. Number 10. Which drug is used to treat opioid-induced respiratory depression? Option A. Naloxone. Option B. Naltrexone. Option C. Methadone. And option D. Flumazenil. The correct option is naloxone.